Ronell Nolan, President, CEO, Health Agents for America, coming to you live, and Faith is underneath my desk wanting to be petted, from Baton Rouge, Louisiana, from the HAFA house until we get the HAFA office put back together, which just seems to be a slow process, especially with the pandemic and the fact that our builder got the virus. So it's definitely affecting a lot of people. We do have a new platinum sponsor, and we would like to welcome and thank National Insurance Partners for sponsoring HAFA. And you're going to learn a lot about them at the August 5th Power Hour. So we definitely want you to join us in July, but also in August to meet our new partners. You'll be able to find their logo and their link very soon on the HAFA website, so you can reach out to them. And if you need to find out more information before we actually get that information out to you. We're excited to say that HAFA has been working with Representative Shaw Blackman from Georgia regarding transparency in commissions. This bill has now passed the Senate unanimously and is headed to the governor's desk. As soon as HAFA can, we're going to have a meet and greet with Representative Blackman in Georgia to thank him and give him a HAFA PAC check. Thank him for all his hard work. This bill has taken at least 2 years to pass. But HAFA's been in constant contact. I flew down and met with him last year, the end of last year, about this bill. I know NAFA Georgia has worked really hard with Representative Blackman also, but we'd like to thank the Georgia House and the Georgia Senate, and look forward to the Georgia governor signing that bill into law. Lordy B, something new every day. Alexa can now answer questions for Anthem's customers about their health benefits. I mean, nothing amazes me or surprises me anymore. There are now going to be new small group health plans being introduced that are called Cigna plus Oscar. So it's the first time Cigna and Oscar have come together. You're going to find those small group plans in Atlanta, San Francisco, and Tennessee. So if you're an agent, a member in those areas, look for this new plan. It could be a new tool in your tool chest that helps. I haven't investigated to find out if they're going to pay commissions. I hope that they choose to do correctly and pay commissions. Exciting news to hear that the hospitals lost their bid to keep the rates secret that they negotiate with insurance companies. We continue to call for transparency. There's also a call for publication for fair drug prices to be published. Now, wouldn't that be good? All this shouldn't be secret. Being in so many committees and hearing so many testimonies, nobody wants to tell the price of anything. Nobody wants to admit how much they charge. It's ridiculous. Everybody else has to be transparent. Absolutely, agents and brokers, we're transparent. A lot of cases, it's easy to say we get paid $0 or $10, but we're absolutely transparent. The biggest news on the street, however, is the House Democrats have released an enhancement bill to the ACA. It's 154 pages, and the HAFA legislative team have divided the sections and are dissecting each section to evaluate how it affects our industry. We're going to be having a Zoom meeting in a couple of weeks to have our team go over each section. Why is it important to us? How it affects us positively or negatively. On first glance, I noticed a couple of things. The removal of the family glitch. That's something we've been calling for a long time. Removing short-term medical. There are folks that still don't get that. Still the inclusion of navigators and their funding. And I'd like to point out that we're listing as alphabetical D. Behind navigators. So this is not in alphabetical order. And honestly, I am tired of being an afterthought. If you're going to list who works on health insurance policies, at least do it by alphabetical order. But stop putting us behind navigators. it's insulting, and it's ridiculous. This bill also changes the name of COBRA notifications. They have the protection from excessive, unjustified, or unfairly discriminatory rates, revoking the 1332 waivers, and a lot of pages are dedicated to Medicaid and CHIP. Now, what we're hearing is this bill will probably pass the House, but will die in the Republican-held Senate. Last week in Louisiana, I heard testimony on a House resolution bill asking the AG to remove Louisiana from the lawsuit against the constitutionality of the ACA. That bill resolution failed in House Insurance. The testimony discussed the Texas lawsuit that includes 20 states in the United States, and the most recent headlines is the fate of Obamacare is in the hands of the Supreme Court yet again. So, assuming that President Trump does not get to replace any of the current justices, the Supreme Court is unlikely to agree with the lower court judges who ruled against the ACA. Chief Justice Roberts twice broke with his conservative colleagues. I don't think he ever votes with his conservative colleagues, but he has twice broke with his conservative colleagues in lawsuits attacking the ACA. And Roberts is especially likely to reject the Texas plaintiffs' legal arguments. So watch for that, and I'll give you some more updates on that. And then if that's not enough in the news, the Trump administration is expected by Thursday to file a legal brief urging the Supreme Court to strike down the ACA. Most of the states in the United States have had an uptick in COVID cases. I'm not sure if the test results are accurate when some say that they're being counted more than once, but we've had more folks that are passing away, more folks that are being diagnosed. And I know in Louisiana, they have stayed in phase 2 instead of going to phase 3. Texas governor is calling for some changes, closing of bars, things like that. And I know in Florida, they said Miami is supposed to have $500 penalties for those not wearing a mask. So the world is, as I always say, is going to hell in a handbasket. There's a lot of things happening. What I would ask you to do is be safe, take care of your family. It just seems like every day you hear of somebody that was, around somebody that did have the virus. Thank goodness I haven't been around anyone who has had it. I try to stay pretty isolated, but I do go to the Capitol. And the Capitol, they definitely take your temperature. You have to have a mask on. But once you get in, I'd say I'm in the minority with my mask on. And even though it's hard to breathe, I do keep it on. I'd rather be safe than sorry. I have no idea, whether masks are a good thing or a bad thing, because you hear so many different things. But just to be safe, and the fact that I have an older mom and a sister that's had a heart attack, I would rather just wear a mask to be safe. But until next Monday, please have a wonderful, wonderful week. Take good care of yourself, as I said. Thank your Georgia House and Senate representatives. Watch for this legal lawsuit going through. And as soon as we have the breakdown of that new Democratic bill, we will give you an update from the legislative team. But I am proud and honored to represent HAFA, the Health Agents of America Freedom Fighters. Rynell Nolan.